women are 100 times more at risk than men, but we're both at risk. Age is definitely one of the most important risk factors here. It is, although we do see certain young patients with breast cancer, it is more common in women age 50 and older, even 60 or 65, that it's more common. If you have family history of cancer, meaning relative in first degree, that's also, it increases the risk of having breast cancer. Having genetic markers, there is a gene, actually several genes, but the most important here are called the BRCA, which are the breast cancers. BRCA1 and BRCA2, these are certain genetic mutations of certain genes that we actually test certain patients. And nowadays, if they have family history of breast cancer and they have the BRCA genes positive, in some cases, we do recommend prophylactic mastectomy, which means that even when they don't have cancer now, the risk they're going to develop it in the future, it's too high. So some patients go through the surgery before actually developing any symptoms. So it is very, it's a good thing we have nowadays. Unfortunately, not many women are BRCA positive. More than 80% of patients with breast cancer do not have family members with breast cancer and are probably not positive for this gene. So this is very limited, but for some patients, it is useful. Patients who had their first menstrual period very young, they are at risk because, of course, if they had their first menstrual period young, that means their hormones started to, let's say, increase at a younger age. So as I was telling you, this cancer, it's very responsive to hormones, so they are at risk. Also, women who went in the menopause in older age, because of course the menopause is when the when basically certain hormones, basically when the women stop having their menstrual periods, they don't have any more eggs in their ovaries, so that the hormones stop, or certain hormone at least decreases its level, so it doesn't create any more risk. But if you are older than 50, 51, 52, and still having your menstrual periods, that means you still have certain hormonal levels that are in a high level, so that means you're at risk also. That image, it's a little, I don't know, particular. I chose it because that's the way we learn it. Women that have no children are at higher risk. Who never got pregnant are at higher risk of breast cancer. So this is not necessarily the 100% of the times, but nuns are at very high risk because most nuns have no children. But of course, that can happen to a person that is not a nun, of course, and didn't have any children. So people with no children are at higher risk. And unfortunately, higher body mass index, which is obesity, it's related. So if you've seen my previous webinars, you know that obesity is a risk factor for most of the conditions we've talked about. So that's something we should really address.